informational webinar on the funding opportunity that was announced last week called the Impact Awards. My name is Sharon Ramelchek, and I'm the program manager for a project here at Genetic Alliance called the National Genetics Education and Consumer Network. We'll talk a little bit about that project later in the context of this award opportunity. I also want to introduce James O'Leary, who's the Chief Innovation Officer here at Genetic Alliance. James and I will be tag teaming today's presentation, giving you an overview of the award and how it fits into the mission here at Genetic Alliance. And then we'll answer your questions about the award and what will be considered. Please send in any questions you may have using the chat box throughout the presentation. We'll try to answer those as we get them, and then at the end we'll have some dedicated time for questions and answers. As a reminder, today's webinar will be recorded and archived and made available on the Genetic Alliance website at geneticalliance.org/impactawards. And that is also where you can find all accompanying materials and the full RFP for this award opportunity. A little background on Genetic Alliance for those of you who don't know us well. Genetic Alliance is a nonprofit health advocacy organization, and we were founded in 1986 as the Alliance of Genetic Support Groups by a social worker named Joan Weiss. Our mission was to do just that, serve as an alliance and support network for disease and advocacy support groups. While we still have strong partnerships and connections with the network of disease advocacy and support organizations, our mission has changed to focus on transforming health by engaging individuals, families, and communities. Our work has dramatically changed to include a much broader network of partners and scope of activities that directly engages both individuals and families and communities, and then the public. I won't go into too much detail about the structure of Genetic Alliance, but we have three main focus areas for our efforts, which you can see the names of below. BioTrust is focused on translational research for individuals, families, and communities, and this is the area where our CEO, Sharon Terry, focuses most of our efforts. Expecting Health includes all of our maternal and child health efforts, including Baby's First Test, and helping individuals understand newborn screening and health for mothers and babies. And lastly, Genes and Life programs focus on putting genetic and genomic information into context for individuals and families. And this houses a number of our public education and outreach efforts, including family health history and access to genetic services and support. This particular award opportunity is part of a larger initiative at Genetic Alliance called the National Genetics Education and Consumer Network. This is a project that Genetic Alliance leads and is funded by the Genetic Services branch of the Maternal and Child Health Bureau at the Health Resources and Services Administration. The goals of this three-year initiative are to create a network of accessible tools and partners and to increase knowledge about and access to genetic services, as well as to improve the quality of those services. This project is led in conjunction with the National Coordinating Center for Regional Genetic Services Collaboratives, or NCC, which is led by the American College of Medical Genetics. And it's mentioned in the RFP, but for those of you that don't know or haven't connected with the regional collaboratives, these are regional programs funded by HRSA with the goal of enhancing all aspects of genetic services. And we've worked closely with them for a number of years. Here's some additional information on the NGECN. Here are our objectives. I won't go into too much detail, but you can see how there are some common themes, such as improving access to information, services, and resources, promoting genetics education through new partnerships, dissemination of resources and services information. We work on all of these areas in conjunction with the National Coordinating Center, the regional collaboratives, Parent-to-Parent USA, and Family Voices, as well as our large network of partners through Genetic Alliance. We also have a National Consumer Advisory Group with self and family advocates who help advise and oversee our efforts on this project. So let's get into some details about the Impact Awards. I won't repeat everything written in the RFP, but I will point out some key items, and then we'll leave the rest of the time for answering your questions. Here you can see the purpose of the program. Please note that the funding cannot be used for developing new projects, so pilot programs will not be considered. And the reason for this is that there is a short time limit and limited funding amount. And if you only have a year, it would be hard to just begin to develop a project. We really want projects to be able to jump right in and show their impact. The focus of the grant is to expand upon existing projects. You must be able to demonstrate how you will use one of the 3 listed expansion methods to expand your efforts. I'll briefly go over some of the evaluation criteria. These are all listed in the RFP, but it's important to pay attention to the points awarded to each element. First and foremost, adhering to the RFP guidelines and to the RFP timeline and budget. Your proposal will not be considered if it does not adhere to these items. The rest of the criteria are listed on this in the next slide, but it's important for you to show how the proposed project will build upon a project and how that project has already shown success. So in essence, the project should have already been evaluated in some form and be able to show the impact. You must be able to demonstrate the capacity to implement the project. I've highlighted here to describe the plans for implementation and any potential limitations. And the reason for that is because since it's a limited funding period, it's important for you to be able to realistically implement your project. So if there's potential barriers that may prevent you from reaching individuals, we want to know that when we're considering the project and the scope of the project. Lastly, strong collaboration with the existing community and state-based organizations is a really important item. We do not want to fund projects that overlap or recreate the wheel if someone else is doing something similar. We really want to maximize the impact of these projects and encourage novel partnerships. These are some additional evaluation criteria. They are all listed in the request for proposals. Some important items to note. This is a one-year project from May 1st, 2014 through April 30th, 2015. Organizations may apply for up to $25,000. Proposals should not include indirect costs because of the size of the award. Awardees will receive the funding in 2 payments. A portion of the money will be given upfront, and then the remainder will be given upon completion of deliverables. And lastly, there will be a reference document, the Guide to Successful Outreach and Education Programs, which will be made available to suggest areas to strengthen your proposed efforts. This is a document we've worked on working with the regional collaboratives, the National Coordinating Center, and it highlights some strategies that other projects have used to really reach out and show the impact of their efforts. Using such techniques such as social media, how to evaluate your project, and other important strategies that may be used for your project. And an email will be sent out to individuals when that document is made available. Here are some national resources that may be helpful for you to review. We included these so you can refer back to these when the slides are made available later today. So now we'll reach the question and answer portion, and James is here to assist. So please do send in any questions you have, and we'll get started with answering those. The first question is, will you make these slides available as a handout? Yes. Like I mentioned, these slides, as well as the recording of today's webinar, will be made available on the Genetic Alliance website, geneticalliance.org/impactawards. The first question is, are only projects already funded by the NCC collaborative groups being considered? James, do you want to answer that?
Sure. The answer to that is absolutely not. We really want to encourage a broad range of projects. So though we certainly encourage people to work with their regional collaborative networks as a good resource, absolutely not. The projects do not need to be funded by those groups.
Great. The next question is, what specifically do you mean by indirect costs? James?
Sure. So that's specifically referring to a negotiated indirect cost rate. Usually those that receive government grants have an indirect cost rate. So you can include fringe costs, for instance, on salaries, But the kind of the overhead costs essentially are the ones that you cannot include because of the size of the award. The reason we specifically bring that up, to put it into context for you, is that, for instance, many universities or other organizations will have a large indirect cost rate, sometimes up to or above 50% of the cost, which really eats kind of a huge amount of the money and the ability to use this small amount of money to make a big impact. And many foundations, for instance, put caps on their awards. Anything, for instance, under $75,000, you cannot apply indirect rates to.
Great. Thank you. The next question is, can the project build upon a previous project that has not been active for several years? James?
Sure. So yes, the answer to that is yes. One of the major reasons that we put together this award is because many times there is money available for pilot projects, but then that money dries up, and the ability to kind of expand that project to a wider audience and really make the case to a foundation or an external group that it needs more sustainable funding, or to explore sustainability models, different ways to bring in income for that project. It wasn't there in the initial grant. So we wanted to provide, though a small amount of money, some money to help encourage that, but also to explore some of those methods and have people share those experiences with the community. And that will be a big part of this project, not only helping groups tap into Genetic Alliance's large network of organizations that provide a wide range of expertise, but also then to share back those experiences and the expertise gained as part of these projects with the wider community. So it's absolutely okay for that program to be a few years old, as long as it has shown demonstrated impact. If it's too old and the data isn't relevant to the current reality of genetic services, that's a different story. But for the most part, the answer is yes, absolutely, we will consider those proposals.
Great, thank you. So the question says, it says genetic services in the RFP. What do you mean by genetic services? Does this include services for those with genetic conditions? James, do you want to answer?
Yeah, sure. That's actually a great question. And this is something we struggled with a little bit. So this project is funded out of the National Genetics Education and Consumer Network. And it's important that projects focus on access or use of genetic services such as family health history, genetic counseling, genetic testing, et cetera. That being said, we will accept projects that show a large impact on the documented need of those living with genetic conditions. And the documented need is important there, such as things like access to support, as long as the scope is large enough. That is not just disease specific. So it really does need to show a demonstrated impact on genetic services, access to genetic services or use of genetic services, or it needs to show a very clear impact, large impact on the needs of those living with genetic conditions.
Okay, great. The next question is, does the proposal for the grant need to be written in a way that we would need a grant writer? Our organization does not have one. So I'll answer this one. As you can see, this award was written, it was meant to be short, so it's not a 60-page grant proposal, which is why we've limited the proposal, the entire narrative, to 8 pages. And since it is a small funding amount, we believe that as long as the proposal addresses all of the elements that are required in the RFP, it will be considered. So no, it does not necessarily have to be written according to NIH standards, just as long as it lists and includes all of the important elements and adheres to both the RFP timeline, budget, and guidelines. Okay. The next question is, what do you mean by outreach? Does outreach include research projects? and I'll answer that. The focus of this award is really to fund programs that reach a population in need, and this could be through campaigns, trainings that educate on a specific topic, or through the promotion of collaborative products or tools, different approaches, but really to reach and educate individuals. If it is only a project that only does research and there's not an education component, the projects won't be considered. You must have already also have evaluation metrics in place that show how the efforts have been successful at reaching individuals, and then demonstrate how you will build upon those existing efforts. James, did you have anything else to add to that?
No, I think that's great. Yeah, we do want to show an impact on the lives of individuals, families, and communities. We absolutely see the need for more data around the needs of individuals living with genetic conditions. Unfortunately, that is not part of this opportunity, but it is certainly something that is a focus of Genetic Alliance. And if you'd like to collaborate with us on that, please be in touch, absolutely.
Great. The next question is, can some of the funds be used to support adding an additional staff member? James?
Sure. So we are open to the methods that you show to expand your program. I will say that sustainability is an important part of this. So if you are adding an additional staff member for the year to show impact, we do want you to be thinking about what's going to happen when the year's up. So if this is, towards a specific outcome, to show specific outcomes, tell us how you're going to use that information to have continued funding. If the project is actually only needs a year to complete your goals and objectives, to make a measurable impact in the country, tell us that. Just make sure that if you are including your outreach methods are just essentially adding a person, that you're very clear on how that's going to impact the sustainability of the program and actually increase the sustainability of the program.
Great. So the next question, and I think we touched a little bit on this, but I'll elaborate just so it's clear. The question is, can funds be used for direct services, such as genetic counseling and genetic testing? And our answer would be no. This project should be focused on outreach and education, but if the project was geared towards education about genetic counseling or creating materials that help connect individuals in the communities with genetic counseling or genetic testing, understanding aspects of genetic testing, that may be something that would be considered, but not for the actual direct services.
And just to add to that, we are willing to work with you on the proposal around some of those details. We know that we're asking for people to submit a wide range of projects here, and every project is going to be different. And so it's another reason if people submit a solid 8-page proposal, we will go through the review process and we will select people. But then we will be providing access to different experts in the field. We're absolutely willing to work with you at the very beginning of the project to help refine some of those details. So submit it, let us know your limitations. That is a major part of the proposal. And we can try to work with you to help address some of those issues. I mean, this is not a one-size-fits-all box. And we know that, and we do that on purpose because we want to hear from you what are your most successful programs and not make it burdensome that you have to write a 60-page proposal. So, please submit, and we'd really just like to see a range of projects.
Great. The next question is, are there criteria that need to be met to qualify as a population to be included? For example, does the population need to be affected by known health inequities? James, do you want to answer this?
Sure. So the answer to that question is you must show demonstrated need. So known health inequities I mean, that is a pretty broad term in and of itself. And so I don't want to be too prescriptive in this answer. I mean, I can say off the top of my head, many individuals with genetic conditions face major barriers. So as long as you show a good knowledge of what those barriers are and you can communicate that to our reviewers and show that demonstrated need, we're relatively flexible on how you define your community. So just to be clear on that, some people might define their community as, a range of genetic conditions. Some people might define their community as a specific geographic population. We're fine with a range of definitions of community and the population that's served. And if we don't answer any of your questions fully, feel free to chat, type into the chat box for a clarification. That's absolutely okay.
Great, thank you. The next question is, can outcomes reflect a change in current volume of the outreach efforts as a result of the project, or do they have to be patient or population specific? So the answer to this question can be found in the evaluation criteria for the RFP. One of the main ways the project will be evaluated is if it can show a significant expansion of an existing project, and you can see listed there can be that whether it reaches a larger size of population, additional diseases, or geographically. It does not have to meet all of these elements, but to be able to demonstrate how it will expand significantly for the outreach efforts. The next question is, partnering with the regional genetics collaboratives is encouraged in the RFP. Are regional collaborative programs themselves eligible to apply for this award? James, do you want to answer that?
Sure. The answer to that question is absolutely yes. As long as the applying institution meets the criteria laid out in the RFP, they're absolutely should and apply. The reviewers just, we will use standard review criteria that if anyone is associated with the group with the application that's being reviewed, they will excuse themselves from reviewing that application.
Great. We've received a question about using the funds to build upon infrastructure such as website development to make aspects of the project easier to access. Would this be something such as expanding additional website capacity and staff time so that you're able to expand your reach? Is this something that would be considered? James, do you want to answer that?
Sure. So the answer to that question is a little bit more complicated, which is the expanded scope actually does need to be shown as part of the project during the year, meaning that you must scale the project during the year because that is, the impact we're looking for, but also we want you to be able to share those experiences in scaling the project. So in and of itself, just expanding content or expanding functionality isn't enough. That being said, if you are adding something specific to an existing program that will allow you to scale, absolutely. I mean, technology is a major way to do that. You just need to document some sort of information that supports that approach. So let me just give a quick example here. A lot of times people will point to including social media outreach as part of a communications campaign. Social media is great for reaching certain audiences. It is not great for reaching all audiences, every social media platform is not created equal for each purpose. And so just adding a social media component to a program probably won't show a strong scaling effect. If you were to use, for example, one of those approaches, we would need a lot more information on how you're going to do it, who you're approaching, etc. But And that's just an example, and I give that example because it's probably the most frequently cited and also one of the most problematic in terms of just a blanket approach.
Okay, great. So the next question is specific to our project, but it definitely is applicable for many applicants that might be of interest. The person says that they already have an existing project that they're looking to expand into another area, although they're considering 3 different areas, approximately all the same size and budget. Do they need to choose a specific region and put that in the grant when they're planning to expand to when they're applying, or can they leave it broadly that they plan on expanding to a different region? The answer for that would be yes, you should specify exactly what region you would be expanding to. Part of the evaluation criteria is being able to demonstrate why it is that area is in need and the population that you'll be reaching within that area. So it would be important to specify where your plans for expanding your project and to where and why.
And just to add on to that as well, one of the things you'll notice in the RFP is that we do ask you to include any in-kind work, essentially. What we mean by that is, what else are you doing? We know that this is only $25,000, and your project might be much bigger than that. It also might be smaller than that, which is why we do specifically say up to, because we want you to request the amount of money that fits your project, and that will certainly impact our ability to award it. But if you're reaching out to 3 regions, please tell us that. We want to know how this fits into the larger initiative, the larger impact that you're making, especially because in this case, if we're able to help you maximize your impact in one of those regions, a lot of those experiences hopefully will transition or also benefit some of your other activities.
Okay. So the next question is, would you be more interested in funding a project that focuses on multiple genetic conditions or a project focused on a single condition? James, do you want to?
Yeah, I'll jump in on this, and if you have anything to add. So either is fine. I do, as I said earlier, though, either for disease-specific projects, it should focus on access to genetic services, or use of genetic services, and that is important. If you are looking at kind of needs of individuals with genetic conditions, plural, then we wouldn't be as interested in looking at one specific condition. And part of the reason for that is, as everyone on the phone knows, or if you don't know, Genetic Alliances focuses across diseases, and we work with thousands upon thousands of groups that work across many diseases. And what we see is, while the needs of individuals with different conditions, there are some unique needs. Many of the needs are shared. And so we do try and shy away from those that are essentially looking at systemic issues that only look at one condition, because we think that there's a lot that can be done across disease. So something to think about, but absolutely you can submit a single disease program as long as it is meeting that base criteria of access to genetic services. Sharon, did you have anything to add to that?
Yeah, I think I would just emphasize, think about the impact that you can have. Would it be more impactful in this scenario for you to expand your efforts to target, to do education around 3 different genetic conditions, or for 1? And just think about how you can really show your impact with your project. The next question is, have you given this type of grant before? Are there examples of projects of similar scope? Just because the small amount, $25,000, is not a lot of money. James?
Sure. Yes, absolutely. So many of you may be familiar with some of our award programs. A lot of the award programs we've done under kind of challenge or innovation awards in the past have focused on either pilot programs or expanding programs, and we've done kind of a mix of those two things. And so certainly those are on Genetic Alliance's website, both under the Family Health History section of Genes in Life and in our Newborn Screening Challenge Awards section. And you can read about more of those projects. To answer that question a little bit more broadly, though, yes, it is a small amount of money, and we do realize that. But it can also be, $25,000 can be a very large amount of money if added to an existing project or program. And what I mean by that is, I think that a lot of times grants, large grants that we get with restricted funding tend to be relatively prescriptive in what's included. You know, they need an extremely strong evaluation component. There's a lot of reporting criteria, and they don't always offer a lot of support in reaching or expanding the network. And that is something that we're trying to do differently with this. We're trying to actually help you to reach new audiences. We do want to help provide support for working with all the other winners, as well as some of the other projects that we're going to publish this document on successful programs. And that is something, too, that can serve as a resource to give examples. And we will be releasing it after the letter of interests are due, letters of intent are due. And that will provide some more concrete examples of things people have done to make a measurable improvement in their project. You know, just to expand on this a little bit, I always think about kind of with this a little bit with my business hat on, which is to say that a lot of small businesses with seed money of $25,000 can really expand their businesses. And in many ways, that's what we want to think about. Where can we hone in on one specific practice that if we build upon that practice, it will show a large increase in the number of people being reached. And so please, please submit your ideas. That's what we're looking for. And we will do our best to help support you in that program. Also, we do want this to be hopefully a on-ramp for many people to get continued funding from other sources. And the more that we can be supportive of that, the better.
Great. The next question is, can you give us some examples of demonstrated impact? And I want to give an example of, how you might be able to show an impact of a program. So what we don't want is just, to create an educational document that will live on your website and you're not sure who's seeing it or how it's being used. You really want to know that, someone took the document and then because of that document, they are more aware or they went and got screening, or you're really able to show the impact of you making that information available. So, for example, if you were to host a training and did a pre and post test about, have you had screening lately, and then raising their awareness about the different types of screenings, and then asking afterwards if they did go in the past, 3 months to get their screening, you would be able to show, yes, there was some impact, or no, the impact was not there, that you did not raise awareness and there was no action formed from your outreach. So I hope that's a good example.
Yeah, and I think, too, a very concrete example would just be increased number of people accessing a specific type of services as well. We're looking for numbers, and so, I would say don't overthink it in terms of the evaluation. Think about, for you, what is the impact that you'd like to see, and is there a way that this money can help you increase or bump up those numbers?
Okay. The next question is, can funds be used to add a genetics component to an existing program that does not currently relate back to genetics? I'd like to find out more additional details about this, but I think we can answer this just with this broad question. James, what do you think?
Sure. I mean, absolutely. I mean, though this project is specifically about genetic services, I think this community knows very well that genetic exceptionalism is a dangerous thing. We'd rather integrate information about genetic services where people are at. So I'd actually very much encourage people to submit those types of programs, as long as you've shown a demonstrated impact for a similar population or some way that incorporating genetics would be able to, improve your project. So that submitting it that way is a little bit more difficult on the showing your existing success, but I actually think those projects could be extremely strong.
Okay. The next question is, please explain the application process, specifically the first step. Will only a percentage of those who submit the inquiry letter be invited to submit the entire application? And then how long should this initial inquiry letter be? So the letter of intent is just to let us know what projects are, who's planning to apply. It's actually not required. It is requested if you do intend to apply. So anyone can submit an inquiry letter, and then you will follow the timeline for application and submit the entire application by the deadline. And then we don't have a limit of how long the initial inquiry letter be. I don't think it needs to be too complicated or too long. It's really just so that we can know the types of projects of who's applying for us to know, and then moving forward with the project so we can provide the resources if there's additional questions or resources that we think would help you develop your proposal. We just want to make those available.
And just to add to that, we will be sending out an announcement to those who submit an LOI when we release the resource guide highlighting successful programs. So if you submit an LOI, we'll have your email address. We will let you know when that goes up. Though it will also be posted to the website. But please do consider submitting an LOI, both because it will help us determine how many reviewers essentially we need. If there are a lot of applications, we want to make sure that we are ready because we have a very quick turnaround to get back to you, you might have noticed, for the review process. But also, if you do submit something that seems completely out of scope, we will contact you. We won't just let you go forward and submit your proposal as is. And so that is an easier way to tell if your program is in scope.
Okay, the next question is, are individual or organizations allowed to submit multiple proposals? James?
Yes, that's absolutely fine.
Okay. We've gotten a number of questions, so I think maybe just to clarify, does the group being reached or educated need to be part of the general population? Can it be a patient? Can it be providers who are being trained? Can it be health science students? Maybe we can just clarify who it is who should be reached by these outreach and education efforts. James, do you want to take a stab at that?
Sure. So the grant focus is specifically to reach out to not the public, but individuals, families, and communities. So that is the focus. Versus providers, you do have to show the impact on individuals, families, and communities as part of the program. So it can involve those other players, absolutely. but they can't be the end target audience of the program.
Okay, I'm just going through all these questions. We've got a lot of them. Oh, James, would it be possible for you to repeat the first part of that answer? I think someone wrote that you cut out a little bit.
Oh, sure. So the target should be individuals, families, and communities. You can involve the other groups mentioned, providers and health science students, et cetera. But the end goal should be in impacting individuals, families, and communities.
Okay. The next question is, does the applying organization have to be a certain size? Can a small organization with a very small staff apply? And my answer for that would be, of course, absolutely. I think as long as you fit into the eligibility of the award, I think we encourage anyone who's interested and has a proposal that fits within the guidelines and the call for proposals to apply. It doesn't have to be a large nonprofit or a small nonprofit. Just be able to show the impact that you'll have and how you plan on using the money for the project. Did you have anything else to add, James?
No, agreed.
Okay. So I want to, the next question is how many awards will be funded? And I can answer this. So all of the awards can be up to $25,000. We have a total of $175,000 to distribute, but we also, so we intend to plan to fund up to 7 awards with this, with these call for proposals, but at the same time, we are really interested, and you can see it in the RFP that we want to make sure that the programs also are distributed across the U.S. so that there's diverse populations that are being served by the projects. So we will take that into account when awarding that project. James, do you have anything
to add to that? Yeah, if we get a lot of really good proposals that are less than $25,000, we will absolutely consider funding more than 7 awards.
So I think I've reached all the questions. Please do consider sending in any additional questions you have, or please send any inquiries to myself, Sharon Romalchuk, and my email is provided in this slide as well as on the Impact Award page if you have those. Let's see. Let me just, okay. Next question is, can funds be requested for multiple outreach or education projects? I think
so.
Go
ahead.
Go ahead.
I was just reiterating, you can apply, have more than one application per organization, but the whole idea is that it is $25,000, and so a targeted improvement in your project will be much more likely to show a large impact. So if you mean within that $25,000, in one application, I would focus on one program. But if you do want to submit more than one application, that's fine. Sharon, do you want to add anything to that?
Yeah, sure. I would just add that the application can include multiple activities, right? So it can, doesn't have to be just one thing that is increased. It can include multiple ways of expanding the same project.
Right, absolutely. So I mean, absolutely. I would just to reiterate, I would definitely try and focus as much as possible for this program because it is a one-year program and it is $25,000. But yeah, we're absolutely open to people submitting within that, however they think their programs will be expanded the best. As I said earlier, this is intentionally broad in that we want to hear about the best programs and the way that they can be expanded, not only to help support those with funding, but also to bring attention to those programs and to help you improve and expand upon those programs going forward. So you tell us what is best and what you've seen that works best within your own programs.
Great. So we received a question about an organization that wants to create an umbrella organization to fund research that would cover a range of related conditions, including some that aren't currently covered, so it would be expanding to additional groups. And the organization would focus primarily on funding research and does not touch consumers. Would that be an appropriate project for this funding opportunity? The answer to that question is no. If the organization or efforts that you would be funding would be primarily research and does not reach individuals, for this purpose of this award, although you're doing wonderful things, we really want to show how your project has reached individuals, and if it's just research that doesn't reach the individuals, it wouldn't be appropriate for this award. The next question is about whether organizations that either have a funding application already in and have not been funded, or have done a project but have not been fully evaluated yet, if they're eligible to apply. James, do you want to answer that?
The answer to that is probably not. You do have to show demonstrated success to apply for the program. The one thing that I would say is if you've completed a project and you have done some evaluation, and that evaluation has been somewhat successful, but you haven't gotten, let's say, your 1 year or 2 year out, post surveys back, please, but you have strong data or strong results, you can absolutely submit. But if it hasn't been funded yet, if you haven't gone through it the first time as a pilot project, then it wouldn't be appropriate for this award.
And then the next question can really build upon that, and we did mention this, but why are pilot programs not within the scope of proposed activities? And just to reiterate, we really want this award to build upon existing activities. It is a short amount of time, and we know that a lot goes into developing a program and to planning for the program. So that takes a significant amount of time. So what we really want is to fund projects that can really take this money and run with it, and to get into the project and expansion of efforts right away, since it is a short amount of time and a limited amount of money.
And this program is interesting in a way because it touches on something that is often seen more broadly around companies, which is there's usually money available for kind of the seed investment or the pilot program, and then there's money available that if you've shown that you can, in the company, make a lot of money or have a huge number of customers, or in education and outreach that you have shown dynamic national impact. But frequently there's money missing in the middle to help bridge the gap between those two things. And so what we're trying to do is A, do that, but B, also bring attention to that fact that what we need to be doing more of, I think, as a community, is getting projects to scale, to that level where we can really show a large, sustainable, broad impact. And so the more we can do that, the better.
Great, thank you. We got one more question about giving an example of documented success. For example, would peer-reviewed studies that recommend their project or surveys of consumers impacted by our project be appropriate. And I would say that, of course, if you have peer-reviewed studies that show how many people were impacted, what the impact was, that's more than enough to show, to include as, within your proposal. And in fact, projects that don't have peer-reviewed studies, but they can show who they reached, how they reached them, whether, there was a change in action or an increase in knowledge or access, improved access to services. Whether you're able to show that, then that's something you should include in your proposal, but you don't necessarily need to have peer-reviewed studies published on your project. So please do send in any additional questions you have. I think we may have received a lot of questions, and we're happy to answer these. And then if you have questions in the future, please do send those to me. We sent the email to send those, and it's in the RFP as well. So I think if we don't receive any additional questions, we can just end the webinar a little bit early for today, and then please do send any questions you have. So thank you very much, and I want to acknowledge our funding source. This effort is supported by a cooperative agreement, like I mentioned, with the National Coordinating Center and HRSA, and in partnership with Genetic Alliance. So thank you all for your time today, and please send any questions you may have. This is a really exciting opportunity, and we hope that you found this webinar informational and helpful in applying. So thank you.
Thank you very much.